President Trump has decided upon a justification for his controversial decision to cancel Obamacare payments to insurers covering policies for low-income Americans. The insurance companies are getting rich off this stuff. As is often the case with Trump, his argument seems plausible on its face, but, upon further examination, quickly falls apart. And not only that, but Trump is now lending support to a deal that would actually restore the payments that he says are lining insurance company pockets. During an appearance Tuesday morning on Brian Kilmeade's Fox News radio show, Trump pointed to soaring stock prices for the insurance companies, even bringing along visuals. Look at these insurance companies. This is since Obamacare started. Anthem, big company, 270% increase. 270%. And that's since that's Obamacare, Trump said. So since Obamacare, Humana, 420% increase. Aetna, 470% increase. Cigna, 480% increase. He added they got a great deal with Obamacare. The great beneficiaries for Obamacare is not the people. Trump made the same argument in a Rose Garden news conference with the Greek Prime Minister Tuesday afternoon. They've made a fortune, the insurance companies, Trump said. First things first, Trump is cherry-picking his data. He appears to be using numbers since Obamacare was passed, back in March 2010, rather than when it was actually implemented, and most of its provisions took effect in 2014. For example, Humana's stock price is up about 140% since the start of 2014, rather than the 420% since 2010, when the economy was still climbing out of the recession. Cigna is up about 220% over that shorter span since the law was put into effect. And secondly, while it's certainly true that insurance companies' stock prices have risen hugely in recent years, even more than the thriving stock market as a whole, there is very little indication this owes much to Obamacare. In fact, it seems to be despite it, with insurers generally taking losses from their Affordable Care Act plans. A report the rating company AM Best released in June showed the health insurance industry made $13.1 billion in 2016, even as it lost nearly $900 million on its commercial business lines, which include Obamacare policies. The nation's top 6 insurers went on to make a combined $6 billion in the second quarter of this year, according to a CNBC report, but the biggest insurers lost money on Obamacare plans. That's not to say the entire law has clearly been a negative for them. Jeff Sommer of the New York Times summarized it thusly: back in March, the companies have notched profits from expansion of Medicaid, for example, and from services aimed at cutting medical costs, while learning how to insulate themselves from parts of the law that have crimped their income. They have diversified, earning money from businesses that include data management, outpatient clinics and surgical services, as well as traditional health insurance. It would be one thing if Trump argued that the insurance companies don't need federal subsidies because of all the money they are making. That would be a fair and logical argument. But the money they are making doesn't come from Obamacare, and losing these subsidies could tempt insurers who have already been pulling out of some Obamacare marketplaces at the state level and nationally to decide it's no longer worth their investment. In other words, they might continue to make massive profits, and Trump's decision might also hasten the implosion of Obamacare, as Stephen K. Bannon argued. Arguing the former doesn't change the latter. Also not making sense is the fact that Trump just spoke positively about a new deal to restore the so-called cost-sharing reduction payments for 2 years. If these payments are so superfluous and only there to help prop up insurance company stock prices and profits, why try to resurrect them at all? Wouldn't that be something Trump would oppose? Given the arguments above, very little of it makes sense, and coming from a president who seemed to vacillate daily on what he wanted from an Obamacare replacement, it suggests Trump doesn't really have a game plan or understanding of how all of this works.